Hello. Happy to have you all here today. I'm very excited about our guest. I want to talk a little bit about Dr. Lena Green, and then we're going to get into our convo. Dr. Lena L. Green is a distinguished clinical social worker, psychotherapist, and fatherhood practitioner with over 2 decades of experience in the field, impacting New Yorkers through her role as a clinician, professor, and administrator. She's renowned for her expertise in mental health, program development, clinical supervision, and forming strategic alliances. In 2019, Dr. Green was honored with the NASW NYC Social Work Impact Award, recognizing her dedication to social justice, empowerment, and service to the community, the highest accolade from the chapter. Her accolades include the 2015 Mid-Career Leadership Award and induction into the Phi Alpha Social Work Honor Society. Dr. Green's academic credentials include a doctorate and master's in social work from NYU, a BA in psychology from the University of Massachusetts at Amherst, and postmaster certification from Hunter College and NYU. She's an active board member and part of the Delta Sigma Theta Sorority Incorporated. But today we're two sisters having a conversation about many things that impact different communities that we're passionate about, and I'm excited to have the conversation. First of all, I want to say thank you to Dr. Green. I'm excited that we're going to be talking to you today. Every time we get a chance to speak with you, it's always enlightening. I adore the work you do, and I've seen it. Talk to us about the Hope Center.
So the Hope Center,
yes.
Hope stands for Healing on Purpose and Evolving. We are a free community-based mental health clinic providing evidence-based treatment, counseling and therapy services to the Harlem community and beyond.
Okay.
We've been in existence for 9 years, and we are affiliated with the historic First Corinthian Baptist Church. We are the product of visionary pastor Michael A. Walgren. We started with providing services inside of the church, specifically for the church community, when the idea came that we should be separate and apart. And that's sort of how we came to be at the Hope Center.
So that's interesting that you said that, you were providing these services within the church, and they decided there's a decision that we need to do something separate. I mean, I guess I would ask, were these services not available with institutions that are here?
Great question. So I think, when we think about mental health services, there are plenty of services, but when we're thinking about free services, when we're thinking about community-based mental health services,
okay,
when we're thinking about access, and when we're thinking about specific neighborhoods,
right,
like Harlem,
okay,
those services were few and far between. So if you're looking at something like substance abuse or adolescent mental health services, those are the things that you can find.
So I'd love to talk a little bit about your background and your lived experience, how you came into this space. You are a doctor of social work. You do work with evidence-based solutions, but you also are a woman of color, and you are a woman of the community. So that gives you street cred. So
Yes.
I want you to talk a little bit about that.
So I'm a native New Yorker, which I'm very proud about.
Okay.
Also a native Harlemite.
Okay.
So I like to say that I'm 4th generation Harlem. My great-grandparents are here as well. And my parents were raised in Harlem as well. So I like to joke around to say that I'm from an island and a village.
Okay.
A small village on an island.
That's true.
Right here. So I started my career in New York City government. So working my way up for about 20 years in various areas, including the Department of Health and Mental Hygiene, and then for the Department of Social Services, which is actually the largest social service agency in the country. I came to the Hope Center actually during the pandemic. We as in Harlem, we as in New York City, we as in people of color were really slammed and hit hard. High numbers of deaths, high numbers of COVID, folks really struggling, out of work, in need of a whole lot of things, but also mental health services. It was during that time that I received an offer from my boss, Pastor Mike, to ask if I would come and run this community-based mental health clinic. And I had to really think about it, I really had to pray about it, because also, I prepared for a life in government, but really thought about how I could really be impactful in my own community. Seeing the need, seeing the toll that it was taking on, the city overall, and how I could do my small part during such a critical time.
When you think about the work that you've done at the Hope Center and the impact you've had, Is there one particular program or situation that stands out for you?
The program that's probably closest to my heart at this point in time is our Thrive program.
Okay.
So our Thrive program focuses on teen suicide or teen suicide prevention and self-harm, specifically targeted toward working with Black and Latino youth between the ages of 12 and 18, so middle and high school students. One of the things that's sort of overlooked and certainly underreported is the high rates of suicide for youth of color. And because that conversation was sort of silent and sort of in the background, I wanted to really bring light to that, because also during the pandemic, I was getting calls left and right from schools, from parents, from grandparents, all kinds of guardians to say, my kid is struggling, they need help. My kid has had a suicide attempt, I'm not sure where to go. And if I would have sent them to the hospital, they're like, I'm not doing that. If I would say call 911 if you are really in need of services, they wouldn't do that either. Also, even taking your child to the hospital at that time, the waiting rooms and the emergency services were overrun. And so you might get to the hospital, but you might not get seen for several days even. And so during that time, I decided that it was my role to just do something to answer the call with regard to just, people's concerns. And we started our suicide prevention program for teens, and we are in year 4.
And the program obviously is free.
Yes.
And do you have a lot of students that are signing up for it? Are there some that come voluntarily? How do they get to you?
Yeah, so they get to us in a couple of different ways. We advertise inside of the church building, since the church is one of our partners.
Sure.
We also share that information with the surrounding schools in this community. And then the best cred is always street cred, right? So similar to other Hope Center services, you tell a friend to tell a friend, hey, right, I've had a great experience over here. You should come try it and check it out. And so our program has grown. We have about 25 to 26 students on a monthly basis. Initially, we started out on a weekly basis, but due to funding changes and challenges, we've gone to a monthly model. But at any given month, we actually see, over 20 students at a time, and they're coming and they're enjoying their time with us. And we focus really on mental health. We focus on social emotional learning. We focus on self-care. We focus on communication. We focus on help-seeking behavior. And we also try to meet some of their other basic needs, like transportation and meals as well.
Excellent. You're educating me, because I really wasn't aware that there was a problem, that it was a disparity in the Black and Hispanic. But when I think about the work that we've done in my firm on gun violence prevention, there are not enough outlets for teenagers, right? In the New York City area, period.
Yeah.
And that causes a lot of issues. And I think social media does as well.
Oh, for sure. Yeah. It's one of the biggest culprits of stress and anxiety and depression as it relates to our teens.
Okay.
And so we have to do a lot of education around that.
Okay.
A lot of training about trusting messages, and also thinking about its impact on the self. Right. Especially as it relates to body image, comparisons.
Right.
So really helping them with their critical thinking skills.
Well, I have to say how I found out about the Hope Center, or more intimately found out about the Hope Center, is that I had come to a church service, I guess a little over a year ago, and I was listening to the service, and you walked out up to the stage and you told everyone to take out their phone. And everyone took out their phone. And I said, wow, this lady walks on stage and everyone listens and takes out their phone. And then you start to talk about this idea of bringing down the pressure, I believe.
Yes. Release the pressure.
Release the pressure.
Yes.
And first of all, it was factual. And it was very interesting to hear about it. So a couple questions.
Sure.
What is that about? Why do you think that happened? I'd love for you to give us an update about the program and what the results were of it.
Yeah. So I would say, me being a community person, me being a member of the church as well. The other thing is that, I try to provide a lot of information around mental health and where people can seek care.
Okay.
And so when we think about heart health and releasing the pressure and cardiovascular health, right? Part of that is connected to stress. And stress in our daily lives, which is a part of mental health.
Yes.
And so it would really allow me to really open the door to have the conversation around talking about cardiovascular disease, talking about women's heart health, talking about the disparities around cardiovascular health and high blood pressure in communities of color, and getting people to listen. And so I say all the time, meet people where they are, right? And so if you know that people are using social media as a tool or as a resource, let's get them engaging in the ways that they're accustomed to doing so.
So obviously street cred is important.
Yeah, I think so.
I think so too. So when we think about this idea of blood pressure and the statistics in terms of cardiovascular health, there is this whole concept of weathering, right?
Yes.
I know what you're familiar with that. And I wanted you to talk a little bit about what your thoughts around it, but how you see it in an everyday interactions with some of the constituents that you're servicing.
Yeah, so weathering really is around deteriorating health based on stress. But particularly based on racial stress, right? So that term was really coined by Dr. Rodney. Her studies looking at the experiences and stress levels and heart rates of Black women and people of color overall. And what she found was that racism, microaggressions, discrimination is actually bad for your health, right? The ways in which you have to show up, the daily stress that comes along with living or having these experiences that are, inclusive of bias, right? Not being believed, not being helped. So it is discouraging, right? So it also means that folks who are not supported within the health system or mental health systems are sicker longer, right? They're less likely to engage in treatment. They're less likely to advocate for themselves and ask for help, which means that their bodies are also going to be deteriorating at a faster rate than their counterparts. And so really that's what it's about. So we really do our best to help people think about how can you decrease the stress in your daily life. So whether it's with healthy eating, whether it's with healthy exercise, thinking about how you can lower your stress in your daily life. We're helping people to think about those things, but also finding shelter and finding safety in communities. And that's one of the things that we try to do here at the Hope Center is help people create community, not just with an individual counseling and therapy, but also with our group-based services, which I'm happy to talk more about.
Okay, so tell me a little bit about the results of the Bringing Down the Pressure program.
Yeah, so we were able to get a little over 1,500 people to sign up for what we call Taking the Pledge, the Release the Pressure Pledge. And it really just says, I vow to take care of my health in the following ways. So, are you someone who has no information about heart health? Are you someone who has had heart health or cardiovascular issues and you're looking for more information? Have you seen your primary care physician? Really providing action steps with that. So we were able to partner with over 10 organizations across the country to really focus in on heart health.
Okay.
Just
Faith-based?
Faith-based,
okay.
Yes, faith-based partnerships across the country. So partnering with churches and really getting the message out, right? So providing education, making sure that people know that, over 50% of Black women over the age of 18 suffer from high blood pressure, and many don't even know it, right? So that in and of itself, that knowledge is power. And so making sure that we're providing information and showing people how to get help, what they can do is really just an incredible opportunity to engage with many folks across the country.
I'm curious to know when you think about the work that you're doing, is there any particular program that you have happening now that you're excited about that you want to share?
Yeah, so really exciting news. In December, we were awarded a little over $500,000 check from the Borough President's Office. So super exciting for us. Our first opportunity to receive government funds to create a mobile mental health clinic right here in Harlem to serve our community. So it's really going to be Hope on Wheels. And so we are building a mobile mental health clinic, so a mobile van from scratch. And we are targeting specific areas across Harlem. So we parked at places like 125th Street and Frederick Douglass, 116th Street and Lexington Avenue, 110th Street and Central Park West. So really looking at, where are places that we know are, have high density, high population of folks struggling with mental health issues, or where folks are in crisis. Also, we'll be working with the NYPD as well as the mayor's office to talk a little bit about, how else can we be helpful in serving our community and really being a mobile mental health clinic on wheels. You won't need an appointment. You will just be able to walk right up to the bus, get more information about our services, sign up for services, get some education. We hope to also have a psychiatrist staffing us as well so people can learn more about medication management as well as counseling and therapy.
Excellent. That's exciting. I'm looking forward to seeing mobile.
Yeah.
In our work, we talk about this idea of the web of inequity. And so it's the idea that, sometimes people, our clients come to us and, whatever they're trying to say or do, whether they're trying to sell a new drug or, any type of initiative that they have, they're very focused on that, right? But what we're trying to share with them is that it's a web of inequity. So when we look at the person, when we look at a situation, we have to understand that there are other things that are impacting the decisions and choices that people are making. And I want to know if you could talk a little bit about that in terms of how Hope Center manages and how you see it on an everyday basis.
Yeah, so we really try to look at the social determinants of health, right?
Absolutely.
So do people have access to food? Do people have access to healthcare? Do people have access to shelter, right? Also looking at things like employment. Are you underemployed? Do you have children, right? What about your, financial resources and access? What about poverty? So all of those things. And so we are asking those questions here. We know that we can't treat every single thing, but we can help people manage the systems that they encounter on a daily basis.
Right.
And we can provide them with a community of support here at the Hope Center. We also do our best, especially with our group-based services, to provide hot meals for all of the folks receiving services with us, because we know that food insecurity continues to be high in the populations that we serve. And we also, have various partnerships that allow us to do things like partner with a place like, for example, Harlem Grown, so that they know, how fruits and vegetables can be helpful for your diet. Also, how to prepare those meals, even if you don't have access to a stove, right? So we've done things in our community garden in the back where we've had food and cooking demonstrations, thinking about other populations. So looking at services for our seniors, our aging populations. We know that things like isolation, like mobility, and also contribute to poor mental health. So we have been able to implement things like chair yoga for our seniors, which is actually one of our more popular groups.
It's funny when I hear you talk about some of the initiatives that you do. One of the things I talk about is shame, because for some folks it is embarrassing, and there is shame around not having enough food or not being able to provide for your family. Just the idea of literacy and health literacy, right? And the idea that not everyone is going to raise their hand and say, I can't read. And what I like about what you're doing is that you are providing the services that help to kind of silence the shame, right? So when I think about the programs that you folks have for, I think it's the breakfast program, right? So now you don't have to go around and say to someone, do you have breakfast, right? You just have the breakfast there if you want to come and have it. And so folks can now maintain their dignity, but still get the help that they want. And I think that's so important.
Yeah, right, it's about access. Right, so if I'm providing it for you, you do get to turn it down if you don't need it, but you also, because it's being offered to everyone, don't have to stick out like a sore thumb because you're getting something or asking for something that someone else is not being offered.
I mean, I agree with you. For us, we talk about what's the least common denominator, right? So if you write something for someone in a 3rd or 5th grade reading level, and you happen to have a 12th grade reading level, good for you, you understand. Right. On the reverse of that, we don't have that option, and no one's going to turn around and say, I don't, so that's important.
Even when someone filling out forms, right? Because even to receive services, you have to fill out a form.
Yes.
And so we try to make sure that all of our forms are at least at a minimum at a 3rd grade reading level, so that folks who do have lower literacy levels can participate. We also say, in our messaging, if you aren't able to fill out the forms on your own, we're happy to assist you when you come to the office to do that. And sometimes people, have all kinds of challenges that we don't think about. Maybe you can't see as well. Maybe you can't hear as well. Maybe you're not as savvy technologically.
Maybe you couldn't pay the cell phone bill this week, so then now you have 2 weeks with no cell phone service.
That's right.
And you don't want to have to tell anyone, I don't have cell phone service because I couldn't afford it.
That's right. That's right. And so, we do our best also to, we provide information on social media, on the larger screens during our Sunday announcements, but we are also tabling at as many events as possible so that people can walk right up to us and have the conversation. And we're doing our best to make sure that our advertisements and our information is colorful and engaging and welcoming, so that the staff can also engage with folks.
Definitely. It's interesting, in the 20 plus years I've been doing this, some of the things you've talked about are resonating for me. But now I think about where we are now, right? And it's an interesting time nationally, and I wonder how that's going to impact these communities, how they engage with healthcare, how they engage with their healthcare, how they engage with the system. And I'm curious to know if you've seen a change in how people are. We have statistics like Black women losing their jobs. Sure. We have statistics in terms of folks not getting access to health care, whether it be Medicare, Medicaid. And I'm wondering if you're seeing a shift in mental health, and there's just a shift generally in terms of the constituents that come to the church and the program.
Yeah, so I would say we've had, in the past, many people have come in talking about anxiety and depression and grief and loss. Those are some of the most important or highly requested services when people are looking for help. They're coming in with that. But over the year, we've seen an increase in people struggling with substance use, right? Because they're coping or attempting to cope. We've also seen an increase of folks saying that they are more financially insecure because they have lost their jobs. And then when they lose their job, that also means that they lose access to their healthcare insurance. Right? And so we're thinking about how do we support these folks as they go through these transitions. So even more of a reason for us to have things like the mobile mental health van.
Yes.
That will be out in the community. Even more for us to make sure that we're doing things like having a resource fair, or making sure that when there are other organizations that are providing services, that we show up and table in those spaces too, so that folks can know that we also have free services available.
And I think, one of the things I'm thinking about is there'll be a need for remediation, right? In terms of trust, connection, creating community.
Yeah.
And I wonder if we look at what that looks like, what kind of support you would need besides funding to kind of make that happen. I think in the last year or so, when I look at social media or news media outlets, no one is really addressing the pain and the discomfort that a lot of people in our populations are having to deal with. And that dismantles the trust they will need to participate in clinical trials, the trust they will need to get access to care and to take care of their mental and physical health, and also the physical safety that folks are feeling and the emotional safety.
For us, partnerships are really helpful.
Okay.
Because it allows us to reach more people.
Okay.
It allows us to think creatively about how we can work together to, solve some of the challenges and problems that are out there.
All right. So we were talking about this idea of trust, and then you were saying that in this age, in this moment, right, which is for some people a good moment and for others is struggling. You are doing. What is the church doing to answer that call?
Yeah. So I think on the church side, they are doing a couple of different things focused on women in ministry, focused on what they have there, focused on men, so the men's talks. On the Hope Center side, I can talk a little bit about our population-based services.
Yes. Okay.
So for us on the Hope Center side, one of the things that we're doing, especially to support our men, we are doing things like men's talks only. We do something called In the Den, where we really invite some experts to come in and talk about mental health and lead conversations that are focused on, how folks are doing, how are folks asking for help? What are things that you need support around? So is it manhood? Is it fatherhood? Is it healthcare? Is it mental health? How are you taking care of yourself? And then also providing resources, because we never want to forget to provide that so that people know where to go to when they're seeking help. We've also done some men's health walks. So we actually gather in front of the church. We've done it probably 3 times over the course of last year. We'll do that again this year. It's really just for men. They come out, they commune together, they go on their community walks, and then they're conversing, and then they come back and they're able to sit with one another, share lunch, have a meal, and then again, talk about some of the pressures that are happening for them in life. And then it also gives us an opportunity to hear what needs can be met via our services here.
Right. It's funny that you mentioned about the men's talk, and then you were talking about the mobile health clinic. And it's interesting because my approach to creating community is time. Meaning that, people want to say blood pressure is an issue in the Black community. We get that. But do you have permission to have that conversation? Have you taken the time to get to know me? Have you taken the time to understand who I am? And then once you do that, you might have permission to have those conversations. So I think that's important. And in that thought, I want to talk a little bit about stigma and this idea of stigma in terms of mental health and seeking help generally.
Yeah.
Pastor Waldron talks about, trying to be strong is nothing to be complimented on necessarily, right?
Yeah, it's certainly overrated, right?
Yes.
So, and actually we talk more about being courageous more than being strong, right?
Yes.
So it's courageous to ask for help.
Right.
It's courageous to step out, on faith or in faith, right?
Yes, it is.
It's courageous to be vulnerable, right? And have that conversation. And we help people think through, so who is in your circle of support, right? Who would you identify as someone that you can trust, right? And what would you trust them with?
Right.
And then if someone, answers the question and they say something like, well, I don't really trust anybody, well, then that's a conversation in and of itself, right? So let's talk a little bit about your experiences throughout life that have caused you to have that stance, right? And we talk about it as a protective measure, as a protective factor, the things that you have done in your life to survive, right? And so helping people get from survival mode to thriving mode, right? So that they're not constantly in this fight or flight state, physiologically and psychologally, that they can actually, so helping people, what I like to say is go fishing, right? And my thing is go fishing is like being curious, right? So throwing some things out there and then seeing what you get back.
That's interesting. It's funny when you talk about that, because what came to my mind is that I'm struggling now. I don't say that with the work that we do and the research we do with the participants that are generous enough to allow us to interview them, I can't deliver trust, because when some of them share some of the issues that they've had with the healthcare experience, right? That doesn't equal trust.
Right.
So you're wonderful, Dr. Green. It feels great to be here. I went to XYZ Clinic and seeking support, and they made me feel like I was a drug seeker. To me, it happens all the time. If you're with me, you feel comfortable, we have a great conversation, I'm affirming, I'm supportive, but then that same person who might have some challenges goes into another environment and has a different experience.
Yeah. So in my profession, right, we say we want to start where the person is. Right. So we're going to meet them where they're at.
Right.
So one is acknowledging the harms historically that have been done to people of color, especially Black people, within these systems and these structures, right? So naming it, then educating ourselves on that, but also really helping people walk through and listening to their experiences and reflecting back what they've shared with you.
Okay.
So that's one piece. The other piece is really helping people to advocate for themselves, right? And get into the place where you're writing things down so that you don't get into, let's say, a doctor's office and then you're freezing because you are having a difficult time navigating with this authority figure, right? Or this person is being incredibly dismissive of your experience, right? So helping them prepare, asking questions beforehand, working with our clients to do research beforehand, and really understanding what's important to you. What are the things that you want to take away from this conversation? Let's walk through that together so that you can then be prepared when you walk into that space. So that's one thing. We also do things like, our therapists call other clinicians with our clients, right? Because maybe they're not able to do that on their own, but can we do it together? So maybe I'm advocating for you, or I'm sitting with you in this moment while you advocate for yourself.
Interesting.
Yeah.
Okay, great. So I want to talk to you. Gosh, you're doing amazing work with populations that don't get that type of services that you offer. How do you train your clinicians? How do you support your clinicians so that they can really give their best to the constituents?
Yeah, great question. Well, for one thing, it's important for all mental health clinicians to know how to take care of their own mental health. Right. So burnout is real, and also secondary trauma, right? So when you are listening to people's traumatic stories all the time, all day, several days a week, several hours a week, several hours a day, it's a lot to take in. So we do quite a bit of training here with our clinical staff to ensure that they know how to do proper assessments, right? And we're doing that on a regular basis. We also have what we call clinical supervision. So we do that where our senior staff is able to provide that one-on-one support to our developing clinicians to go through any challenges that they may be having, not just for their clients, but also for themselves. We also do other practical things that are really important, right? So we're able to, talk about cases amongst ourselves so that one person doesn't feel like they're responsible for someone else's full life, right? So we've got several clinical supervisors that can help strategize about what's happening. And then we also do things like we like to have fun together, right? We're making sure that we're breaking bread and having a meal together, that we're laughing together, that we're also talking about social issues that are, of the day together, so that we can also talk, do some temperature checks about how everyone's doing, so that no one also, feels alone in this process of just letting folks know that there is support available. Right. And we do that in several different ways, and we do that on a daily basis. Yeah, I think we also provide a lot of freedom to our clinicians to provide services in ways that make them also feel purposeful. Gotcha. So for example, if you are passionate about women's health, right? We can support you in creating a group that focuses on women's health. That also includes mental health, right? If you are, passionate about supporting fathers, well, let's talk about the mental health implications about being a parent. What does that mean? Are there a single parent navigating? Are there communication challenges? Are there, co-parenting challenges? All of those things. So folks have the opportunity and the freedom to not just train you, but to also lean into their passion when they're thinking about the populations that they want to serve. Got it. Okay, great.
It's interesting in the work that we do, which is, really marketing research, and it's qualitative and quantitative research. And I do a lot of work with with different types of clients, but many of our pharmaceutical clients are looking to have a diverse population involved in clinical trials, but it's very difficult based on historical issues, which we know, right? Some is current, as 10 years ago or less. And so that does impact how people engage in clinical trials, but it's important, and many people could benefit from it depending upon their disease state, if it's some type of terminal cancer or other things. So from where you sit, what are some things that need to happen to just basically encourage more people to just even open their minds to clinical trials?
Yeah, I think giving people an opportunity to ask questions and providing education about what's available and what's possible.
Okay.
Right. Many people also come into mental health treatment because they are dealing with debilitating illnesses or life-threatening illnesses as well, or sometimes end-of-life care. Right. Sometimes it might be even a caregiver. Right. So giving yourself an opportunity to share that information specifically with, certain communities that may not have access.
Yes.
Giving folks an opportunity to ask questions. And just making it available, right?
Okay.
Sometimes it's more simple than we'd actually think.
Okay.
So I think just doing that, and then partnering, right? And willing to have the conversations as many times as necessary. And then if you are, in a particular field, you need to be partnering with credible messengers. Otherwise, you won't get the results that you're looking for.
And in your mind, who's a credible messenger?
I think people from the community, people who have been serviced, people who have had great experiences, people who have received the services, right? Yeah.
Do you think, from our standpoint, we practice racial concordance. We want to make sure that the people who are conducting research for us are matching the ethnicity and background.
Sure.
Do you think that's important in what you're doing?
Absolutely, right?
Okay.
So if you look at, our staff, right? We have 18 staff here. Most of the staff reflects the community in which we work in.
Got you.
Right. So 90% of the people that we serve identify as Black. The majority of our staff and clinicians identify as Black as well, right? So we want to make sure that you don't have to go elsewhere to receive the care that you need. You can do that in your own backyard, in your own community, with folks who look just like you.
Right. Well, I think I'm a big believer in the credible messenger as well. I think this environment is sort of trying to shift that a little bit and kind of downplaying it. But I think we need it now more than ever. We need credible messengers now more than ever.
Yeah. And I think we've got to make sure that we are the ones speaking about our own experiences, and that we are not allowing other people to tell our story, right? That we're getting out there. We know that we're contending with things like social media or, false narratives that are out there that may be, in the news or what have you. So it's really up to us to ensure that we are taking control of those stories and making sure that we're being responsible about providing information that is readily available. And checking our resources, right? Checking the data.
Yes. Oh no, that's important for sure. Absolutely. And where the data is coming from.
Absolutely. 100%.
Right. Absolutely. So for sure. It's interesting because when I think about mental health, I still have family members and relatives that say that look down on it. If you have your Bible, right? And you got your 23rd Psalms, and that's enough. So to understand that seeking mental health help is not a sign of weakness. How are you tackling the stigma in the Black community around mental health?
Yeah.
And how do you?
Well, I certainly grew up with tons of stigma, but I also grew up in Harlem in the 80s, right? So growing up and being raised in the church in Harlem, I was certainly told to, pray any challenges, pray your fears away.
Right.
You are depressed, you should be talking to God about it, right? And so my tagline really has been, prayer and therapy. You can actually do both. And so growing up in Harlem, seeing things like mental health, like substance use, like, all kinds of challenges as it relates to physical health, food insecurity, poverty, ravage our community. It was tough, right? I also had parents who both struggled with substance use at some point in time. That really impacted my own experience as a child growing up, which really led me into the field of mental health because I just wanted to understand more about it. And also too, right, like this wasn't necessarily happening in other communities. And so what could we do to make sure that we could turn this around? And that was really my initial interest in the area of mental health, which really just led me down a path. I also didn't know that there were, lots of folks of color who were interested in what I was doing. And so I remember going to college and being very clear that I wanted to focus in on mental health. It was gonna, be in the field of psychology, and then, subsequently learned about what it meant to be a mental health clinician. I learned about the field of social work, interdisciplinary work with both psychology and psychiatry, and thinking about what we call the big three, right? So all three of those professions working together to really address mental health challenges.
And how are we going to deal with the stigma?
And when we think about what's going on, mental health needs are going to be more important now than ever.
Absolutely. So we're going to continue that positive messaging, right?
Okay.
That it's okay to ask for help.
Okay.
We're here.
Okay.
I'm someone who looks like you.
Okay.
I'm someone who also engages in mental health treatment.
Right.
Right. But also providing ways in which folks can get involved without outright saying mental health, right?
Right.
I don't think you have to slap people in the face with the information either. I think you can expose them to good experiences and also say, hey, actually, this is led by a mental health clinician.
You know, it's funny that you talk about this idea of not throwing things in people's faces. And I find that with people of color, Black people, Hispanic, if you're socioeconomic, all those factors, people tend to throw things at you. And I talk a lot in the work I do about being delicate, right?
Yes.
You know, and so delicate in how we serve it up, right? Delicate in how we share this information, because people will listen, but it's also how we approach them as well.
Absolutely.
Right.
Right. And I think being curious really helps you get to the answer.
Okay.
So someone, if I'm saying, you know, we have counseling services available, someone's like, well, I don't need that.
Right.
So I might say, hey, well, have you ever actually had counseling services before?
Right. Right.
And they may say, oh yeah, I had counseling one time. And I'm like, well, would you mind sharing your experience with me and telling me a little bit about that? And that's a way to just open the door, open the conversation.
Absolutely.
Right. And then I also get to say to them, well, I'm a mental health clinician. And so they might be a little stunned, right? Because they see someone like me who looks like them, who comes from their community, right? So I may share a little bit about my background and things that I've experienced and what has been helpful for me. And so it softens the blow, if you will. And I think people are a little bit more open, a little bit more flexible. And again, right, thinking about creative ways to share the information that feels exciting, right? So when we think about even some of the groups that we have coming up now, we're doing some work that is focused on trauma and mental health. So that's in that way. We are doing something called Rooted in the Body. We are focusing on women's health and looking at fibroids and perimenopause and those kinds of things that also impact our mental health, right? So really looking at what are people struggling with right now that could really give them an opportunity to really focus in on their mental health,
Right.
even if we're not calling it that at the very beginning.
Absolutely.
Yeah.
And I think also too, there needs to be a level of deference in how we're interacting with people. I mean, I know I haven't, but I look at how other people that are interacting with people of color, and I walk into a situation when we're doing research, assuming that the person's not going to trust me, that the person is bringing whatever experience they had previously into that interaction, and whatever's going to happen between us, I have to earn it.
Absolutely. So, certainly, and I think naming that from the beginning to say, you know, I know that I'm coming at this, you know, in a way that allows me to be curious.
Right.
And also sharing with the person that you are the expert of your own life.
Yes.
Right. I'm here to learn from you. And there may be some things that we can do together to work towards your healing journey. So I think that's a way to be respectful and take a posture of deference when you're working with folks.
Yes, and I'd like to see more of our general market colleagues and clinicians kind of take that approach.
Yeah.
And in this environment that we have now, where, I mean, I know both of us are educated professionals, but I mean, I think our trust is tested as well, right? And then so we think about that versus someone that doesn't have the outlets that we have, or the training or whatever that we have, how much more difficult it's going to be to get that person to engage.
Absolutely.
It's no secret that I adore the work you do, and I adore what First Corinthian Baptist is doing. But I guess at this point now, when we think about it, looking at the future, looking at all the issues that you've talked about, what are some needs that you have?
So I'd say one of our biggest needs is really around funding. We're doing our best to diversify our funding. We've been pretty successful in sustaining some of our programs and services.
Okay.
But the truth of the matter is that we just don't have enough.
Okay.
Right. So one area is really focusing in on our teen mental health. Right now, we provide monthly services just because of funding shortages, but like to provide that weekly if possible.
Okay.
We're providing services to about a little over 25 teens.
Okay.
So we'd love to be able to do more on a regular basis.
Okay.
So that's one area. One of the other area that we're looking at really needing support in is really supporting our mobile mental health. So we have funding to build the van, but we don't have the staff to pay for staffing the van.
Okay.
And so want to be able to hire full-time mental health clinicians to be able to support the work. Again, that work is probably a little bit more crisis-oriented, but still heavily needed in the community. And we love the opportunity to be able to hire 2 to 3 full-time clinicians to be able to do that out in the community, and also, providing those ongoing services that we need. Yeah.
Okay. All right. So then, what does a partnership look like with Hope Center? If there's a corporation out here that has their ear open and willing.
Yeah, so a partnership looks like learning more about our work and our services, looking at our data points, knowing the population that we serve, and then talking about a long-term commitment, right? Because I think it's easy to say, we can provide some support at an initial stage, but I think really being able to make a change and see change in behavior and what's possible really comes over time.
Absolutely.
So really looking for some long-term partners and some long-term investment to be able to see the changes that we need.
Absolutely.
Yeah.
Absolutely. Well, I'm keeping my fingers crossed, and I'm hoping that we can partner with some of the companies and organizations that we work with and see this possibility to partner. For sure.
All right. We greatly appreciate that.
Oh, well, I do. And I keep my eyes open because I just enjoy the work you do. It's incredible messenger work. It's work at meeting people where they're at, and it's understanding people's needs without them having to share them.
Yes. So thank you.
Thank you. All right. Thanks.